Welcome back. Switching now to our third midday forum. Joining us is Dr. Dane Todd with Nebraska Orthopedic and Sports Medicine. I think the subject we're about to discuss is fascinating: youth injuries when it comes to playing sports. You know, I know you see a lot of kids coming with problems. Discuss that, please.
Well, obviously we see kids coming with problems from acute injuries, ankle sprains, wrist fractures, things of that nature. But as sports have changed and the participation in youth sports has increased, we've also seen a lot more specialization where kids no longer play baseball and football and basketball and soccer, you know, at various times during the year, but they're a year-round baseball player or a year-round soccer player. So we're seeing some unique differences in the clinics from those things.
What age are we talking about? Kids coming in who are hurt?
Typically it's in that 10 to 15 year age range.
Wow.
Yeah, you'll see some younger kids, and a lot of times it's when the kids start to hit their growth spurts because their bodies are changing, they're getting much taller, but at the same time it's a little tough for them to keep up with their strength and muscle mass to kind of protect themselves when they're playing. I
see 10-year-olds, 12-year-olds throwing baseballs, pitchers, like they're 16 and 17. I mean, they're good, but I'm thinking to myself, are they supposed to be this good right at this young of an age?
Yeah, and that's actually becoming a bit of a problem. We're finding that the earlier some kids are specializing in sports, actually the more injury prone they're becoming. It's just a repetitive overuse kind of injury in certain situations. Especially, we notice it a lot in our baseball players too, in that they'll be throwing not just with their local team, but then they'll be on a travel team and they'll have a pitching coach, and next thing you know, those pitches are adding up.
But they have pitch counts, right? Or certain inning counts, is that?
Right. Pitch counts count in the game. They don't count in practice, and they don't count with the coach.
So. Or when the kid's at home playing with his brother or whatever.
Right.
Okay, good point. So what do you suggest to parents out there in the remaining time that we have, and coaches, who I'm sure most are well-meaning, well-intentioned, but what do you tell them right now if they're listening?
I tell them to make sure kids have adequate rest, take breaks. If something hurts, shut people down. Give them some time to heal and recover.
And quickly, you're going to be giving a seminar coming up at St. Elizabeth, right?
Yeah, next Tuesday evening, we're having a talk on common youth sports injuries, how to treat them, how to get kids back into the game. It's open to the public at 6:30 p.m.
Excellent. Well, thanks for stopping in. It's important stuff, and I know you know, you got to watch those kids. You got to watch them because they're not going to. They want to be out there and impress mom and dad. Yeah. They want to be the hero, but you have to be the adult and watch those kids for the injuries.
Without a question.
Thanks for stopping in. Appreciate it.